I could see myself struggling with like, what can you bring to our team? I think.
Oh, that's very similar to the like sometimes they'll say like we have a lot of great candidates. Can you please tell us why we should choose you?
Yeah, yeah.
So I mean, you've kind of talked about like different strengths that you've had, like right, that you're detail oriented and that like you really like to go above and beyond to build a really good rapport with your patients. You're kind of meticulous in terms of like making sure that you're being safe, and also balancing that with um really enjoying being a team player.
Okay.
Yeah, those are all really great.
Okay. I
Yeah.
need to like take some time and like write all this down later.
Well, and you have the
Yeah.
recording too.
Yeah, I
Yeah.
can listen to that in the car.
And just so you know, you should have, I would say for this to have two stories where you had a patient who had something going on that was critical that you
Mhm.
escalated. Really common examples are like anything involving like sepsis, low blood sugar, stroke rule out, any kind of vital signs that weren't great, like a patient who was bleeding, a patient who fell, like anything where it was like, this isn't great. Let me like escalate this and like work this up, let the doctor know so that this doesn't become like a really serious thing.
So I did come up with two examples. So one of them was recently, I work at an allergy clinic. So we do immunotherapy injections where we're injecting people with what they're allergic to. And one patient had just received his injection. And literally, as soon as he walked into the waiting room, he came back to the shot station. And I noticed he was really flushed. He was teary-eyed and looked like he was getting some eye swelling, and he's like, I think I'm having a reaction. So I grabbed him and brought him to the treatment room. And on the way, I grabbed the vitals tree, and we have flags outside of the doors. So if there's a reaction, we have to open up all of the flags. So as I brought him into the room, I opened up all the flags and called my coworker to get the doctor. And she could tell because I'm really quiet that because I yelled for her to get the doctor, she knew like there was a reaction. So while she went and got the doctor, I had him sit down at the table and attach the blood pressure cuff to get that going. And while that was going, I took out the emergency medication kit we had in the room. And I was talking to him the whole time just to try to calm him down because I could tell he was getting really freaked out. His eye swelling was getting worse. So I drew up the zero point 0.3 of epi, which is what we usually give for his age and size. But obviously, I waited for the doctor to come in before I gave it because I can't just give it. So I got that ready. We usually give Zyrtec too. So I poured some Zyrtec into the cup, just anticipating the doctor's orders. And luckily, his vitals were all stable, but he also had hives all over, nasal congestion, like all of the typical symptoms of severe reaction to his shot. So as soon as the doctor came in and saw him, she was like, go ahead and give the epi zero point 0.3. So I did that, gave him the Zyrtec because the doctor ordered that too. And then I stayed in the room with him for about an hour, just checking on him throughout that whole time. But if I needed something, I had my coworker go get it or would have someone stay with him. So there was always someone in the room with him. So we didn't leave him alone. So that really helped reassure him because he was obviously very anxious. He had been shot on shots for a while, and that was the first time it ever happened. So it was a big scare for him.
So I love this. So this and whatever the other story you have, make sure you tell it early. Have a little note on your sheet like allergy story. And if you see like they ask you, tell me about a time that you had like great teamwork, or like tell me about a time
Okay.
you advocated for a patient, or tell me about a time when you had to act quickly, or a time that you actions you took um helped with the safety of a patient's care, like any opportunity, go for it.
Okay.
Yeah, because this story makes you look like you are ready to go. Yeah.
The other story I have was, I guess I maybe wouldn't say it, but it was when I was an LVN at the nursing facility. But I had a patient that we had just had a wave of a norovirus at our facility, and one of my patients was recovering from it, and he had a history of like hypertension, kind of random, but it's part of the story. He also had a history of hemorrhoids, but I hadn't known him to really have any of those problems in the few months that I had him as a patient. And when I came on to shift, the nurse that worked the knock shift told me that he had some bleeding from his hemorrhoids, and she said she put cream on it like the doctor ordered. So I was like, okay. I was just thinking that's kind of weird because it's not like very typical of him. And I know he hadn't had like any like episodes of like diarrhea or, anything like that. So I asked the CNA if she was busy and if she could change his brief first, and I would go in there and take a look. So she went over there and she called me in there, and there was blood in his brief. And it was like a lot of blood. So I helped her clean him up, and we noticed that he had like a steady trickle of blood coming out of his rectum. So I had her go grab the vitals tree and to grab the charge nurse too, because I was like, I think we're gonna have to send him out. So she started checking. She put the blood pressure on as I was still continuing to clean, and his blood pressure was lower than usual, and he hadn't had any of his medications yet. And he also had like an increased pulse. I think it was like greater than 100. And he also didn't speak English, so I couldn't assess like how alert he was. He only so my charge nurse luckily spoke. So she was talking to him and said he was like really confused. So we're like, oh, we need to send him out. So she called the doctor to get the order because we don't have standing orders just to send people out. So we got the order. I had the CNA stay in there with him because she didn't know how to print like records out. So I gathered up all of the needed documentation. And then within about like 10 or 15 minutes, the ambulance came and picked him up.
Hmm.
But yeah, we recognized right away there's something wrong.
Did you ever find out what it was? Did he have like a GI bleed or something?
I think he did. I think the norovirus kind of like escalated problems he already had because
Yeah.
I'm pretty sure it was some type of internal bleeding.
Another hard
Yeah.
one that I've heard, I think Stanford asked this one is tell us about a time when you communicated something and the message was not received properly. And
Oh,
you could talk about either the stories about the mistake, right? About how like, and then just talk
yeah.
about closed loop communication is so important that there really is no room for like gray area, especially when it comes to like medications and specimens and anything that is like patient specific or like dose specific. Like you have to have really clear communication for safety.
Yeah. Okay.
Um, and so this thing about school, so they could say something like, so have you graduated yet? No. And when do you graduate? Okay. This program is it's very involved. There are floor shifts as well as classes. It's very difficult. People who work or who are in school have a really hard time. I really just I don't think that that would be compatible. So you could say something like, um, I've heard really great things about the program and how it's really supportive because there are classes to help. You're not just thrown onto the floor. You actually get like resources, and I really love that. And I'm really fortunate in my program. They want you to be successful at in the workforce. So if you get a job before you graduate, they'll work with you and let you pace your finishing your program to whatever is appropriate, because their ultimate goal is for you to one, pass the NCLEX and then get a job that you are going to thrive in.
Mhm. Do you think I should even mention to them like that I'm in a BSN program right now
No,
or
unless they ask, no.
okay, so I'll have to fix my resume because that's in there too. I put like in my cover letters that I'm in a program. Because
Well, I mean, it's already on there. That's fine.
yeah, okay. Because I know my teacher actually helped me to get the interview. I think they prefer you to have your BSN, but the HR lady said that because I'm enrolled in a program that I could still apply because it says you have to have your
Oh,
BSN to apply. So I
yeah.
guess that'll work out for this
So
one.
keep it how it is, and they will assume you have already graduated. Just don't tell on yourself, because if you
Okay.
don't tell on yourself, they're gonna think, oh, well, she already took her NCLEX, she finished her program probably. They're
Oh
not
yeah,
gonna
'cause
think about it.
because I did pass the NCLEX. I did like the LVN to RN bridge program.
Yeah.
Uh, yeah, so I'm just working on the bachelor's degree now. So,
Yeah, perfect. It'll probably feel very confrontational when they say that. So like
mhm.
de-escalating it with your answer is the first step, and then assuring them that your program is kind of, they do keep in mind, their two goals is like helping you pass the NCLEX, and then if you do get a job before you're hired, that's the goal, is to get you into the workforce in a place where you're comfortable and happy, and that that's often the case with the program, and that they
Mhm.
will like help you um kind of they'll be flexible and help you kind of scale back the pace of your program in whatever way will help you really get comfortably onboarded as a new grad as well. Yeah.
Okay.
Yeah.